Welcome to Checking In with Amy. My name is Amy Goldberg. I'm a registered nurse with the Elder Service Plan of the East Boston Neighborhood Health Center. The Elder Service Plan is a program to help people who are 55 years of age and older, who we want to live safely, independently, in a healthy manner in their own home. We service the areas of East Boston, Chelsea, Revere, Winthrop, Everett, and now we've expanded our territory to also serve Malden, Melrose, Medford, Stoneham, and Boston's North End. I am delighted today to have our guest, who is Dr. Jim Pedulla. Welcome.
Thanks very much.
Dr. Pedulla is our medical director, and he has been here for 26 years doing this job.
That's right, yeah.
And I've been here 22, so between us both,
we know each other.
We know each other.
Yeah, exactly.
That's true. So tell me, you're a geriatrician. So tell me what the difference is between a primary care physician and someone that might seek out going to a geriatrician.
Well, most older people, their primary care physicians that they go to are typically internists. They've gone to residency in internal medicine, and or a family practitioner who's gone to a formal residency in family medicine. And many persons, as we all finish those residencies, go off into primary care practice and care for people of a variety of adult ages. But a geriatrician is typically someone who's gone for another year of training, in which they're learning more about the very specific ways in which the diseases that old people get interact with just the normal aging that people experience as they age.
Right.
So we are sort of trained to look at the way in which all of these illnesses interact with a specific person, with their medications, with other deficits that they may have acquired, other illnesses they may have acquired with aging. And so we tend to work with other allied personnel, whether it's in coordinated programs or through office practice, agency-based work to try and coordinate how a particular person's burden of illness, their abilities to get by in their home are a challenge for them. And the specific things that will assist in their ability to continue to live, for example, their life at home.
So I have a family member that I love very much, and I'm always saying to him, you need to go to a doctor. Yep. And he said to me, I feel fine. Why do I need to go to a doctor?
So one of the things we want to emphasize is how, though, while that reluctance is understandable, for the most part, finding things early nearly always helps to avoid much more problematic interventions later on.
So what types of things would you be looking for?
Well, in this first slide, I point out, first of all, the silent things that affect the largest proportion of all adults. So it's no surprise that from all the commercials that people see and everything that everyone is aware of in magazines and newspapers, that the problems of diabetes and high blood pressure and cholesterol, they contribute to the largest burden of illness in the U.S. certainly and in the world because of their contribution to heart attack and stroke and the diseases that are the most common. So the most fundamental things that are done in office visits are just checking up silent things like, for example, blood pressure. People should have their blood pressure checked regularly, and there are optimal sort of values for that. It can vary from person to person what's desired to be the treatment goal, but in general, people should have a top number. People may have heard of the top number, the systolic blood pressure. Should be less than 150. It actually was somewhat made more lenient in recent years with older people. It used to be less than 140. It's now felt that less than 150 may be optimal. And the lower number, a diastolic blood pressure of less than 90. There may be many reasons that higher blood pressures are chosen or lower ones for people, and that's what they're in conjunction with their provider, their medical provider, their physician, is determined. Cholesterol. So people are screened for values that, if left untreated over several years, may contribute further to developing stroke, heart attack,
Right.
vascular disease in the lower extremities. Typically, total cholesterol less than 200 is desirable. The low density LDL, or bad cholesterol that some people may know it as, of less than 130, and good cholesterol of greater than 60. Again, these are variable numbers.
Right.
They may vary in different people in terms of what the advice is to control them. There's many reasons why different treatments are chosen, but at least knowing the information is useful, because it's a silent thing. It's not. There are no symptoms from having it apart from the illnesses that come from it. Diabetes. Again, a prominent problem. A person for several years can have diabetes with absolutely no symptoms, just by having a certain blood value above a certain level, usually in late life because of weight gain, often treatable with early diabetes solely with weight loss and diet changes. So diabetes we screen for as well with blood testing as well.
Well, another question would be, what tests should every senior have in order to stay well?
Well, apart from these silent sort of conditions I mentioned, there are other illnesses that come, or conditions that come with aging, that at older ages, clinicians will do blood testing and other testing to screen for, to detect, so that they can be addressed. One of these is chronic kidney disease. Typically, it's a blood test just to look for any onset of chronic kidney disease. Kidney disease affects the doses that your doctor should prescribe for your medications. Having it silent, kidney disease, still helps guide the proper dosing of medications. So that's one minimal reason to do so. But in addition, it can be a signal to a provider to want to control your blood pressure even more, carefully, your diabetes more carefully. So it's a separate condition with blood testing, and otherwise at its earliest stages that's important to screen for, to detect. Diabetes I mentioned in the previous slide. Screening for thyroid dysfunction, very silent condition that is very relatively common, that can come just from the thyroid being less able to produce thyroid hormone as it did for the most of one's life. Easily treatable with a medication that just replaces the natural hormone. And so we use blood testing to screen for low thyroid hormone. Cognitive dysfunction or dementia. Again, nearly 9% of death for all older adults in the U.S. right now is from dementia. And the early detection of it, some treatments may slow its impact on a person's daily life, but in addition to that, being aware of it, or even mild dysfunction, helps physician, families, the patient, with strategies that can optimize their safety at home, their taking of their medications, many things. So being aware of it is important as well, and it's screened for as well. That's done with questioning. So we do it. People may have received what they think are silly questions in an office visit about the year and the month and the day and that sort of thing. They're not meant to insult. They're asked of everyone, and if we didn't ask them, no one would know. So they're meant to sort of hopefully detect early memory difficulty that can be addressed. For osteoporosis, so now especially in women, but also in men, with aging, the loss of bone, of calcium in bone, occurs at a much faster rate. And so, people are also, there's lower calcium intake, there's lots of reasons for it, but that loss of calcium intake can lead to very brittle bones that with even lesser trauma can fracture, typically at the hip, or just spontaneously in the spine, what we call compression fractures. Can lead to unexplained back pain, loss of height. There's a number of things that osteoporosis can create that it just occurs, again, until the fracture occurs, a person may never be aware of it. It's treated with medications and with calcium supplements to try and slow any rate of bone loss. And so for all women over age 65, and often in high-risk individuals earlier than that, if they're very low body weight, a previous smoker, a couple of the risk factors, family history, then the screening tests, which is a special type of radiology test that's done in an office setting where the thickness of the bone, the density of calcium in the bone at the spine and the hip can be detected, is done. And then it's determined with your provider whether the provision of supplemental therapy should be instituted or not, as well as other things, stopping smoking, exercise, other things as well. Abdominal aneurysm. So, actually I skipped one here, but vitamin D deficiency, also now recognized in recent years as being remarkably common in the general population as well. Older adults are spending less and less time in the sunlight, and their intake of things like milk and other dairy products are less. Vitamin D levels can decline, and it's been shown that those levels not only contribute to osteoporosis fractures, but can contribute as well to chronic total body pain, body weakness, overall weakness, and that those things can be improved by being adequately supplemented very simply with tablets of vitamin D levels. Abdominal aneurysm, again in recent years, it's been shown that, especially in smokers certainly, that over the many years that the lining of the walls of the large vessel in the abdomen, the aorta, can thin, and the vessel can just enlarge to a point where, not to alarm anyone, but it can be just a sudden, what we call a ruptured aneurysm, or an emergency event that would lead to a need for emergency surgery that is very dangerous. Right. But they've shown that in people that had a smoking history, when they reach a certain age, they should have a simple ultrasound test to the abdomen to determine whether they happen to have an ultrasound. Because the surgery for an aneurysm, if they have an aneurysm, if they have an aneurysm, if a person has an aneurysm, it's much more easily treated with surgery in a very planned, elective way, and not in an emergency, which is what you want to avoid.
Yeah. So these are very simple. Everyone can do it. There's no reason not to. And then you'd have a good baseline of all that. I know that when you and I spoke about doing this segment, we talked about some new reports that have come out in regard to the main contributing factors for death. And what did you find? You said there was a recent study?
Yeah, they've published the recent sort of, the national statistics have been for the causes of death in older adults, and all adults of all ages. But the number one cause of death is what we call coronary artery disease, or the disease that affects the vessels of the heart that leads to things like heart attack and angina, chest pain, that sort of thing. That affects 20%. That's the cause of death in 20% of women or men. And the major contributors, other than it can develop just with aging anyway, but the things that increase a person's risk of developing it in their lifetime is, again, smoking, blood pressure, diabetes, family history, which a person can't modify, but it makes it even more important why they go and have the other things treated, because they can't change that their relative at a young age developed heart attack or something, but they certainly can address the other risk factors that can be addressed: cholesterol, diabetes, blood pressure, smoking history, all very important. Exercise.
And the second main contributing issue is
dementia is actually is now the second leading cause of death in men and women at like 9%.
Really?
In men and women, but 20%, and then there are the various cancers pretty much that come in a list behind that. So things like, chronic obstructive lung disease, very common, emphysema caused by smoking, years of smoking. At any age that someone can see smoking is a good thing. They should do so obviously as early in their life as we would all wish, but at any age it brings benefits fairly immediately to your daily difficulty with breathing, but also with the risk of future worsening either lung disease like emphysema or COPD, or or the risk of lung cancer in the future. So
let's talk a little bit about cancer screening.
So as I mentioned, in general examination, we're screening for kidney disease and blood pressure and the various main several illnesses, heart disease and otherwise, that people can experience. But cancer is probably one of all the other additional things that brings someone, that is why there's fear of going to the doctor. But the good news is that in some of the major cancers, that early detection is absolutely crucial to having fully curable and treatable cancers. And two of the most notable of those are breast cancer and colorectal cancer. So in women, certainly over age 50, and again, it'll vary, but in general, mammography is absolutely shown to improve outcomes when done with regular screening for people. Colonoscopy, for all adults, men or women, after age 50, they should receive their first colonoscopy. Colonoscopy looks from the entire bowel of the large bowel for polyps. People don't develop cancer of the colon until it's first a polyp. It's typically a benign thing that's removable with a scope, not with an operation.
Right.
So when it's done at age 50 and there are no polyps, a person doesn't need one for another decade. If a person has a colonoscopy at age 50, as they should, and a couple are found, they usually receive another one in 5 years. If more than that are found, it's usually at 3 years after that. And it changes as they now have none after the additional ones, then it can go back to 10 years or so. But it's a very important one because colon cancer is actually a very slow developing cancer. And so it lends itself to screening and removing its potential cause because it's something you can find the things that lead to it and remove those and move along. So colorectal cancer screening also extremely important for people to proceed to. Prostate cancer, more controversial because they've found that the blood test for prostate cancer can be abnormal but really not be due to prostate cancer, can be due to a natural increase in the blood test level and lead to testing that may cause men a lot of anxiety or may lead to even potential some side effects of the testing, the biopsies and other things. And so the recommendations now are that there be a good discussion though. So a geriatrician or other people will speak to their patient about how they may feel about blood testing for prostate cancer. That a particular person may feel that they feel good and they don't wish to proceed with that sort of thing. They wouldn't want to have false tests that were not serious. But there are many people who would want to proceed anyway, and whatever testing subsequently might be recommended, that they would recommend. So if someone's in their office visit, they should at least ask about, should I have a PSA, or the blood testing for prostate cancer, or I would like a PSA, but to have that dialogue with their provider, who should also be bringing it up. For cervical cancer, so women who may be older in late life who didn't really go through the usual every few year cervical cancer testing as a younger woman, it's still recommended that they're receiving perhaps additional final ones after age 65 if that hadn't been done adequately. So it can occur later in life, cervical cancer, so it's an important additional screening test for treatable cancer. And more recently, in the last few years, which hadn't been around for a long time, is one of the leading causes of cancer death in the U.S., which is lung cancer, probably the predominant cancer death in the U.S., lung cancer, is screening for early lung cancer in smokers. So from this slide, you can see that if people have had a long pack year history of smoking, a certain number of packs for a certain number of years, and if they're within a window of about 15 years since they stopped, so even people who have stopped smoking, they should have a discussion. A discussion should be held with their primary provider, their physician, nurse practitioner, or otherwise. They should have a discussion with them about whether they would want to proceed with annual low radiation CAT scans of the chest.
Okay.
CT scanning of the chest. It's not the amount of radiation that's done in a regular CAT scan of the chest. It's low dose so that it's not a risk for causes of cancer.
Right.
Low dose radiation. And in that scan, they look for nodules that may have been appeared. And then sometimes those are not, nothing is needed to be done about them. They're just then served, people then will receive every few months or every 6 months rechecks on the little nodules. Your doctor or a specialist would then discuss whether any of those need biopsy. But these large studies done show that for enough people, many thousands of people, that may be detected and have rather minimal surgery that cures them of lung cancer, of early lung cancer. So it's something for smokers to bring up in their office visit also is, I've heard about this new test.
And
for,
if they haven't
for
heard about it,
screening
they're
for
going
lung
to hear it
cancer.
from you.
So they'll hear it from others
I hope.
that do this as well. So screening for lung cancer, again, in general, something to bring up in your office visit, but also that your provider will be bringing up with you.
Right. What I want to talk to you about now is people who will not go to a doctor, but there are certain things that they must not ignore. So I'd like you to tell me about those things.
Yeah, even for folks that go to doctors regularly, even if there's someone that does go at their 3-month or 2-month visits, all too often they may also, between visits, or again, the person who never goes to one, minimize or ignore physical symptoms. First is vaginal bleeding after menopause. So again, it is only due to nothing serious by exclusion. In other words, vaginal bleeding after menopause has ended, you should be calling your primary care provider or seeing someone regarding that. It can be due to cancer of the uterus, and so again, cancer of the uterus treated early is a highly curable disease, and so individuals shouldn't wait long periods of time before seeking attention for vaginal bleeding after menopause. And chest discomfort. So certainly this is the #1 cause of death in America, and for certain proportions of people who it'll be their only first sign of heart disease is to have sudden death. So chest pain, I hesitate to say even that you can't explain, because it would have to be very obvious to you why, that you were probably just struck in the chest or something. But chest pain that's unexplained, you should seek really emergency room attention immediately. Another one is persisting abdominal pain. So unexplained abdominal pain people may write off as constipation or otherwise, and perhaps with it will become clear to someone that that's the case. But a persistent, really abdominal discomfort should be, you should seek attention as well for that. Changes in your bowel habits. People may have had during their life, they know exactly the regularity of their bowel habits. In terms of, when that alters in a significant way, again, without any real easily identifiable explanation to yourself, you should be seen, especially if there's blood in your bowel movement, in the bowel movement as well. That should be, people should really seek attention for that as well. Okay, because remember, even early cancers of the colon can have bleeding as their first sign and be fully treatable. So, blood in the urine, bladder cancer. People can have cancers of the bladder that's just detected with a single episode of just a blush of pink or red in the urine. Now, that may be due to a urine infection in a woman or a man, but it is by exclusion. It should be sort of looked at and determined that that was the case, if it were the case for doing so. And skin changes, people, the risk of melanoma and skin cancer in folks that have been out, any of us, in the sun for years on end, it increases the risk of developing melanoma, which is one of the more serious cancers that people can develop in terms of detecting early or being very difficult to treat after spread. So unexplained fatigue, sure, it may be very evident to someone the hours they've been up, but the poor sleep that they may have been getting literally, but a really unexplained fatigue should also be assessed by. It can be due to hypothyroidism. I mentioned thyroid dysfunction could be the reason. Unexplained weight loss. People may be trying to lose weight, true, but adequate diet and eating and then losing particular weight is not a normal thing, and so really people should seek assistance for that as well. Sudden visual difficulty or weakness of hands or your legs or with speech or visual changes. Emergency room, seek help immediately, right? Because the reason is that for stroke, just like for heart attack, medications can be given in an emergency room, all right, in the first, I believe it's 3 hours or so, that can markedly diminish stroke that may be developing or prevent one altogether. And so really important to proceed quickly by ambulance to, for the most part, by ambulance to an emergency room. Prolonged cough, especially in smokers, or coughing blood. Prolonged cough or coughing blood, not normal things. It would be a discussion with your doctor as to whether or not, because of COPD or otherwise, it's become your new normal. That could be the case after, but until that's determined, it really should be assessed. And I mentioned for breast abnormalities, so women themselves may detect breast abnormalities, and if they do detect breast abnormalities, they should also seek assistance.
So time matters.
It matters.
Mean, it really does.
Yes, it does.
And I think that people don't want to make a deal, and I don't want to upset anybody. And
right.
They won't take care of me because I'm not really sick.
Right.
When in fact they could very well be.
Yes, and it's a frightening thing for anyone to know until you're at the visit and what it is, what all the things that may go through your mind or what it may be. But in the end, early is better.
Right, and don't drive yourself. I've heard of people that they're having chest pain.
Chest pain and the neurologic changes, that sort of visual difficulty,
do not
visual
drive
changes.
yourself.
Do not do so, no.
I know of people that have done that.
Yes.
And
oh, wow.
it's not good.
No.
So our final thing is what people should say to their doctor no matter what. There are certain things they need to communicate with their doctor. So could you give us a few of those? Yeah,
there's no reason to hold back or to not be truthful about nearly anything about your physical symptoms. So, or your taking of your medications. So tell your doctor, even if you saw them 2 months ago, any new symptoms of any kind, physical or psychological, whether or not you're even taking the medication at all. There are folks that accepted the prescription, leave the office because they didn't want to hurt the provider's feelings.
Right.
And it helps no one to then go home, never fill a prescription, put it on the shelf. So be honest that you have no intention of taking it. Whether the medications are bothering you physically, are causing any side effect, you don't have to accept side effects. Side effects, some of them go away after a period of time for certain medications, but others are permanent, and there are often alternatives. And so one should always mention to the provider that this is causing, or this started right after I started that. All right? And as I mentioned, bothersome symptoms since the last visit, anything new that developed, or whether or not something that's being used isn't alleviating a symptom that you intended for it to, both intended for it to improve.
So, thank you for
you're welcome.
today's interesting and informative segment. I think there are so many takeaways from this, and I hope that people really do pay attention and maybe pick up one little bit of tidbit of interest, and maybe I should pursue something. And it is a dialogue with your doctor.
Yes, all the things I mentioned are obviously generalizations.
Right.
There are very specific reasons why it either wouldn't be considered for a particular person. For example, the screening for a lot of these illnesses, if there is a person who's quite ill with lots of serious illness, then a lot of times screening for other things that would never be, they would never go through is not necessary.
Right.
So no one's going to force people to have various screening things that are not really going to benefit them. But to be able to be in the conversation about what things are right for you is important.
And finding the right doctor, a doctor that you can speak to, feel comfortable with, be honest with, is important.
Yeah, I would think that everyone should seek someone who will have that conversation in which you could say, even ask for, like, what about the PSA test, or shouldn't I have a CAT scan? You can help by prompting. A lot of times, a provider will know they're going to see you for several visits. They may reserve certain things for certain visits, not the first one, but if it's prominent in your mind at a particular visit, then bring it up so that it can be addressed then. If it's something that's important to you then, and it's necessary then that is you should be part of the control of your visit in terms of the things that are important to you.
So thank you again.
You're welcome.
Thank you. And If you would like any information about this particular segment with our geriatrician, Dr. Jim Pedulla, please feel free to give us a call at 617-568-6377, or you can write to us. I would be glad to also send you any information along in our Checking In with Amy bag. And we would like very much to see you again. So until we see each other, please stay well. Thank you. Bye now.